How many of you have ever been to the doctor's office and had your blood pressure taken? It's just one of those things that you need to have checked pretty regularly, but in most cases for all of us, just annually, to make sure everything is in good health. Today we will be looking at what your blood pressure is and the materials needed to take it at home, how to take your blood pressure, and the benefits to self and society. So first, let's get pumped and we'll talk about what blood pressure is. Blood pressure is the amount of force of a person's blood inside of their arteries. Now, blood pressure is almost measured like a fraction, with the systolic number on top and the diastolic on the bottom. The systolic measures the amount of blood pushing through that artery, and the diastolic is what is that number when you cannot quite hear the beat and it's almost just in between the beats. And that is all according to the Cleveland Clinic. And then when you check your blood pressure, you are going to need a nice, lovely volunteer, hand sanitizer to always make sure you practice healthy and safe, cleanly practices, a stethoscope, and a blood pressure cuff, which has a really, really long, complicated name. And then before we check that blood pressure, according to the CDC, there are a couple of things that we need to make sure that we follow before taking blood pressure, just to make sure accuracy is all correct. Some of these things include no eating or drinking 30 minutes prior to taking that blood pressure. Using the restroom can help improve accuracy. Sitting in a chair that provides back support and has your feet flat on the ground. And having bare skin to strap that cuff around to ensure a more accurate reading. So, first things first, you will take out all your materials like I am doing now. You are going to take your blood pressure cuff and you are going to put it, this side? Is it this side? This side. You're going to put it around your patient's arm. I'm pulling up your shirt a little bit. And you're going to put it around that upper arm, slightly above the elbow. You want to make sure that it is snug around the person's arm to also make sure that it is an accurate reading. If it's too tight, it'll be awkwardly low, and if it's too loose, it'll be awkwardly high. And then you will want to start pumping. Usually, I like to pump to somewhere around 160 to 180 with a nice normal blood pressure. Signs of hypo or hypertension you can fluctuate with. But once you pump it all the way up to your desired pumping, you will shove the stethoscope right over that artery. Not like that, but get the idea. You will shove the stethoscope under the artery, or under the cuff over that artery, and you will start to turn the valve on the pump so it will deflate. Usually with a healthy adult, you will start to hear beats at around 120 to 130, and this is your systolic pressure. And then while you keep deflating, you will hear them stop, and usually for a normal healthy adult, that will be around 80, and that's how you have your diastolic, and that's how you have your blood pressure. Now, there are several benefits to self and society when it comes to taking your own blood pressure at home. According to Wake Forest School of Medicine, there is a 30 to 40% decrease in health complications when you take your blood pressure every day, including health complications including strokes, heart attacks or heart failure, and even death. Also, hypertension is increasingly found in adults over the age of 50, and even more so in adults over the age of 65. So checking your blood pressure pretty regularly will help identify these problems, whether they are big or small. So today we looked at what your blood pressure is, the materials needed to take your blood pressure, how to take your blood pressure, and the benefits to self and society. I hope that you guys can use this to help anybody you need to. Thank you.